This is Dr. Amal Abdarrahim. Today we will start our primary healthcare course, rehabilitation lecture. The contents of this topic is we'll understand the definition of the rehabilitation, the objectives, the importance of rehabilitation, the types of rehabilitation, the process, measures, and unmet needs for the rehabilitation. So, what is rehabilitation? Rehabilitation is defined as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. يعني الناس اللي عندهم health conditions أو disabilities مهما كانت أنواع disabilities دي نحاول شنو نساعدهم عشان شنو to function normally و to interact with their environment. Okay, فهي it addresses individuals with مثلا conditions زي pain, improves the way individual function in everyday life and supports them to overcome the difficulties that they have with thinking or seeing or hearing or communicating or eating or even moving around. So it is a set of measures that assist individuals, disabled individuals who experience or likely to experience disability to achieve and maintain optimal functional in interaction with their environment. This is the definition according to World Report of Disability. So what are the objectives of rehabilitation? The objectives are prevention of the loss of function, or slowing the rate of loss, or improvement or restoration of function, compensation for lost function, and maintenance of current function, either to prevent, to slow, to improve, to compensate, or to maintain the lost function. Okay, so what are the importance? Why rehabilitation is important? You know that 1 in every 3 people in this world will need the rehabilitation service in their lifetime. will need ما معناها أنه حيستعملها لكن في حوجة لها because it improves the functioning outcome to adults with children with different chronic conditions. مثلا adults with dementia صح؟ محتاجين يعني يتذكروا exercises معينة عشان يقدروا يتحركوا to function normally. people with arthritis اللي عندهم آلام في المفاصل محتاجين to function normally. children اللي عندهم cerebral palsy محتاجين to function normally ويكونوا independent صح؟ avoid costly hospitalization and reduce hospital lengths of stay. تعمل rehabilitation لزول اللي عنده أسمة ورسول اللي حصل له حادث ويتكسر بالفيزيوثيرابي وكده بتقلل hospitalization time. Okay, minimize or slow down the disabling effect of chronic health conditions, their cardiovascular diseases, their cancer, their diabetes. لأنه أنت بتقدم self management strategies and assistive products they require or by addressing the pain or other complications. So rehabilitation almost داخل في أي part of the care. It also enables individuals to participate in education and gainful employment, remain independent at home, and minimize the need for financial or caregiver support. So, what are the types of rehabilitation? The rehabilitation is divided into 3 types: occupational therapy, physical therapy, and speech therapy. Occupational ما عنده علاقة بالwork إنما it is everyday activities. Okay, so it is a treatment to help individuals who require specialized assistance to participate in everyday activities. The goal is to assist individuals to live independent and satisfying life. زي الناس اللي عندهم مشاكل في الحركة صح؟ Physical therapy is the therapists that provide treatment صح for others مثلا pain, difficulty in functioning, moving or living life normal. Speech therapy resolve عندهم speech issues. Speech therapy can help treat a wide variety of issues involving language, communication, voice, swallowing and fluency. حتى البلع حتى المشاكل. Right? Each form of rehabilitation serves as a unique purpose صح؟ يعني أي واحد عنده its own function in helping a person reach full recovery. لكن هم كلهم عندهم same objective صح؟ أنهم to help the patient to return to a healthy and active lifestyle. So, example of a rehabilitation exercises to improve a person's speech, language, and communication after a brain injury, or modifying an older person's home environment to improve their safety and independence at home and to reduce their risk of fall, or also making, fitting, and educating an individual to use a prosthesis after like amputation البروسيسس اللي هو الأطراف الصناعية or prescribing medicines to reduce muscle stiffness for a child with cerebral palsy or even psychological support for a person with depression or training in the use of a white cane العصاية البيضاء for a person with vision loss. فانتوا هسه شايفين انه rehabilitation عنده multiple forms and you can now sense how important is rehabilitation. وبرضو نتجوا لفاct أنه rehabilitation is a multidisciplinary. Different actors are joining in the process of rehabilitation. Nurse, doctors, psychologists, engineer, community worker, social workers, different actors. The rehabilitation process is to identify the problem. مثلا patient with cerebral palsy عنده multiple problems. عنده problem with the speech طبعا. عنده problem with the movement. الفاميلي عنده problem psychological. So you have to identify the problem or problems and then relate problem to modifiable and limiting factors. But some problems cannot be يعني modifiable. لكن تشوف الحاجات that can be modifiable and then define target problem, target mediator, select appropriate measures, okay, for rehabilitation, and then plan the implementation, coordination, and intervention, and then assess the effects of that implemented interventions. If there is another problem, then identify it and we. What are the rehabilitation measures? Rehabilitation measures are rehabilitation medicine, rehabilitation therapy, assistive technologies. The rehabilitation measure medicine is concerned with improving functioning through diagnosis and treatment of health conditions, reducing impairments and preventing or treating complications يعني مثلا surgery أو كده. طيب therapy is concerned with restoring and compensating for loss of functional and preventing or slowing deterioration in functioning in every area of patient's life. So the therapy will include training, include exercise, strategies, education, support, counseling, modification of the environment, provision of resources, and so on. Assistive technology is any item, well, a piece of equipment or product, whether it is acquired commercially or modified or customized, that is used to increase, maintain, or improve functional capabilities of individuals with disabilities. Assistive technology ممكن تكون شنو؟ الأطراف الصناعية كويس، السماعات، العصايات اللي بيستعملوها العميانين، البوكس اللي بتتكلم. مثلا هسه أي زول في التلفون حقه عنده ماجنيفاير، عنده توكن زوم، عنده اسيستنس. فالأزيز الاسيستيف تكنولوجيز. نيجي نشوف مثلا example ل rehabilitation. عندك مثلا child with cerebral palsy and rehabilitation. The difficulties مثلا faced by child is unable to care for itself، صح؟ فالrehabilitation major ممكن ناخد therapy واحدة assistive technology. الثيرابي يكون training for the child on different way to complete a task، مثلا ياكل براهو، يمشي الحمام براهو. وممكن برضو الثيرابي يكون فيه counseling the family لأنه it is difficult بالنسبة لهم psychologically. وبرضو assistive technology is to provide equipment for maintaining posture and self-care. possible outcome يكون عنده better posture, better respiration, better feeding, better speech, better physical activity and performance. طيب potential barriers بالنسبة لي أنه timeline for the intervention، يعني ممكن ياخد زمن طويل، صح؟ ممكن يكون financial capacity بالنسبة للأسرة بتاعة الطفل، ممكن يكون availability of الفاميلي ذاتها or support or availability بتاع assistive technology مثلا، صح؟ أو availability of therapist نفسهم. People involved in this measures is the child himself, the parents of the child, his siblings لأنهم بيكون في training في كده فمحتاجين أنهم يتدربوا يساعدوهم. Extended family, psychotherapist, occupational therapist, school teachers, doctors, and of course nurses. So as you can see that rehabilitation is highly patient-centered. أي patient عنده his own rehabilitation plan. We have multidisciplinary team, صح? Different health professionals, language therapist, speech therapist, occupational therapist, prosthesis, physical medicine, doctors. It is you can use the rehabilitation for acute and also chronic cases. الزول اللي حصل له كسر، الزول اللي حصلت له psychological trauma، والchronic cases زي الديمنشيا، زي الدايابيتس، الناس البوليو، السي بي and so on. طيب المشكلة عالميا شنو؟ المشكلة عالميا انه في نقص حاد في الناس بتاعنا الريهابليتيشن، لانه بيفتكروا انه الريهابليتيشن ده زي رفاهية وبيفتكروا انه مكلف، في حين انه it is not رفاهية. فحاصل في lack of prioritization funding policies and plans for rehabilitation at national level. وفي لا برضو يعني lack of available rehabilitation services outside urban areas و long waiting time، يعني حتى المراكز بتاعة العلاج الطبيعي اللي هي جزء بس من الريهابليتيشن ما موجودة مثلا متوفرة في الولايات كتير. وفي out of pocket expenses and non-existent or inadequate means of funding. العلاج الطبيعي مثلا أو السيرفيس اللي بتقدم بالريهابليتيشن أغلبها ما تكون داخلة في التأمين، مثلا زي البروسيسس ما داخل في التأمين. ولاck of trained rehabilitation professionals with less than 10 skilled practitioners per 1 million population in many low and middle income countries. فدي فرصتكم يا شباب، لأنه في جاب كبير في الناس التريند في الريهابليتيشن، وبرضه في lack of resources including assistive technologies, equipment and consumables. The need for more research and data on rehabilitation، برضه في gap في الداتا، وفي ineffective and underutilized referral pathway to rehabilitation. احنا مثلا زول حصل له حادث، حصل له brain damage، المفروض to involve ناس rehabilitation وكده، لكن ما قاعد يحصل، فما بيودوه، أو بعد ما يبقى كويس يطلعوه لأخصائيين حتى ما عرفوا يشوفوا علاج طبيعي وكده، فعشان كده ineffective أو sometimes ما بيشتغلوا. the rehabilitation. That is all for the rehabilitation. Thank you for listening. You have two questions. Please answer.